Hello, welcome to the University of California, San Diego Chronic Kidney Disease Program. My name is Norma Regev, and I am a licensed clinical social worker. Our healthcare team includes a nephrologist, pharmacist, nurse, social worker, and a dietitian. My role is to help educate patients learn about kidney disease and the treatment options available to them. This is one module of a 6-part series discussing treatment options for failing kidneys. In this module, I will talk about conservative management. Our goal is to help empower you with knowledge to make informed decisions about your kidney treatment choices. We know that needing to consider kidney treatment options can be a big decision. You have the right to decide how your kidney failure will be treated, and you can choose conservative management instead of dialysis or transplant. Conservative management for kidney failure means that your healthcare team continues your care without dialysis or a kidney transplant. The focus of care is on your quality of life and symptom control. It is a proactive choice that is usually decided on when other options will not improve your quality of life. What can I expect from conservative management? Your healthcare team will help you create a plan to meet your care needs. This team may include a nephrologist, pharmacist, nurse, dietitian, and a social worker. You will continue to see your doctor regularly and have lab work done. Have ongoing management of your symptoms such as anemia, swelling, nausea, blood pressure, or shortness of breath. Your care plan may change as your quality of life and health status changes. Treatment goals for conservative management can include avoiding treatments and hospital stays that may worsen your quality of life. This may mean fewer medical appointments, blood draws, and medicines. Managing other health problems caused by kidney failure like anemia. Providing you with additional emotional support. Helping preserve your kidney function for as long as possible. Management of your symptoms such as nausea and poor appetite. Optimizing your quality of life, and preparing for end-of-life care. Here are some things to consider. Those with kidney failure may choose no dialysis. This is a personal choice. Sometimes the patient and family don't agree on this. It's important for patients to talk about what they decide with their family and care team. It's also important that the patient's wishes be respected. Talking to other patients with kidney failure and the choices they have made can be helpful. Learning what treatment is really like can help make the decision more clear. Keep in mind that conservative management won't cure kidney disease. Your kidney function and how you're feeling will influence the care you will receive. Here's what a nephrologist has to say about conservative management. Here is Dr. Tamara Rabenzik, nephrologist and palliative care specialist with UC San Diego Health.
Really, anybody can consider conservative kidney management. Most often, however, conservative kidney management is considered in patients who are less likely to derive a benefit from dialysis. Patients who fall into that category include patients who are older with multiple medical problems, and those patients might not live longer with dialysis and might suffer greatly from a much more negative quality of life on dialysis than they would without dialysis. Really, it's about whether or not you would benefit from conservative kidney management and whether or not it's something that you want. I would say the biggest consideration for someone who's thinking about conservative kidney management is thinking about the quality of life associated with dialysis compared to conservative kidney management. We do know that most people who choose dialysis, either hemodialysis or peritoneal dialysis, will live longer with dialysis than they will with conservative kidney management. That benefit of living longer goes down greatly in older patients and patients who have a lot of medical problems. That can be a little harder to predict, however. So really, when thinking about conservative kidney management, I really focus in on the quality of life and encourage patients to think about what quality of life they're looking for as they look ahead. So conservative kidney management avoids unnecessary procedures, extra procedures and surgeries, more time spent in facilities or in the hospital away from their family. Conservative kidney management um, avoids those things. So if you go down the path of conservative kidney management, you don't have to worry about a surgery for access placement. You don't have to worry about going to the clinic 3 days a week for dialysis. You avoid the complications associated with dialysis that often lead to frequent hospitalizations and more time away from family. And even in individuals who might consider peritoneal dialysis, that also requires a surgery and requires nightly peritoneal dialysis at home. 3 days weekly hemodialysis can lead to a lot of symptoms. It can lead to a lot of fatigue after dialysis. A lot of patients, especially again older patients, more frail patients who go to dialysis, are pretty wiped out the whole day after dialysis. So they essentially lose those days, the dialysis days. They're spending them either at the dialysis unit or recovering from dialysis. So just, thinking about the main patients who would benefit from conservative kidney management. Again, patients who are older, who have multiple other medical problems aside from their kidney disease, they're the patients who would derive the most benefit from that treatment path. Patients who really feel as though the cons of dialysis are greater than the benefits. Patients who feel as though going to hemodialysis regularly, doing peritoneal dialysis nightly at home is a large burden, would greatly would negatively impact their quality of life. When it's a life that they can't imagine living, those are the patients really who should really consider conservative kidney management. There's another group of patients that I haven't touched upon, and those are patients who might not be able to safely receive dialysis, patients with cognitive dysfunction, and patients who might have severe other underlying medical problems such as severe heart failure or severe liver disease, where dialysis itself really might cause more harm than good. Those patients as well would really benefit from conservative kidney management.
What does conservative kidney management involve?
It's not doing nothing. It's really aggressively managing kidney disease and the side effects of kidney disease, doing aggressive medical care up to actual dialysis. So what it usually involves is frequent visits with your nephrologist and your nephrology team. Often in advanced kidney disease, that can be as frequently as once a month. It will involve taking a look at labs, taking a look at physical exam and symptoms, and adjusting medications to target any symptoms you might be having, and also to help your kidneys work for as long as possible. So it's still complete aggressive medical care, just leading up to dialysis. As kidney disease progresses, as symptoms progress, you might need to see your doctors more. Sometimes other teams might be brought in, such as palliative care, teams that really focus on symptom management beyond what the general kidney team can provide. And then as kidney disease progresses more, if patients become have a harder time going to the doctor, start to have more symptoms and feel more unwell, when patients get closer to the end of life, at that point, your providers might start talking to you about hospice care. And hospice care really focuses on end-of-life care, on keeping you as comfortable as possible. At that point, your doctors wouldn't be checking labs frequently, but would really be focusing on symptoms and on keeping you home and comfortable with your family at the end of your life. I would add, just for patients who are considering conservative kidney management, to just really think about the pros and the cons of dialysis and of conservative kidney management. Some of this I've said already, but really thinking about what your goals are in life, what your goals of care are for your medical care, and what you're hoping for um, as time goes on. The other important thing to remember is that you can always change your mind. So choosing conservative kidney management isn't a decision that's set in stone. You can make a change. So for some patients, they might choose conservative kidney management. They might decide that they don't want dialysis and go down the path of conservative kidney management. But if your goals change or symptoms become severe to the point that you would like to try dialysis or switch to dialysis, that is an option. In the same regard, some people might choose dialysis and they might start on hemodialysis or peritoneal dialysis, and at some point might decide that's no longer for them. They don't want to continue renal replacement therapy, and those patients might choose to switch to conservative kidney management. So you can always change your mind.
Since the goal of conservative management is to keep you feeling well and maintaining your kidney function for as long as possible, there are some things you can expect from your care team and with each phase of your symptoms as your kidney disease progresses. They typically occur in 3 stages: mild, moderate, and advanced symptoms. We will talk about each of these in greater detail. When you're experiencing mild symptoms, your healthcare team will closely monitor your kidney function and other organs that could be affected by your kidney disease. Make adjustments to your medication or start you on new ones to help slow your kidney disease. They will talk with you about diet and lifestyle that could include what to eat or drink or what to limit, and ask you to complete or update an advanced healthcare directive. This is a legal document that states your care preferences and who you would want to make medical decisions for you in the event that you become sick and cannot speak for yourself. Once you begin to have moderate symptoms, your healthcare team may check in with you more often about those symptoms, adjust your medicines to control them, discuss support options that might include palliative care, mental health, and other community care services. Create a plan to avoid healthcare setbacks or lessen their impact on you. And finally, confirm your choice about dialysis. If you're experiencing advanced symptoms, your healthcare team may adjust your medications to help you from feeling sick, help you reassess your needs for safety and comfort, ask you about hospice care, educate you about what to expect as your disease progresses in the last months, weeks, and days of your life. And finally, provide you with the support for emotional aspects of grief and thoughts about the future. Let's compare conservative management versus dialysis. Conservative management focuses on your quality of life by also addressing your comfort and health for as long as your kidney disease allows. It can improve how you spend your time with a goal of managing your symptoms and keeping you out of the medical setting as much as possible. This way, you can spend more time at home with your friends and family. You will also spend less time in the hospital and have fewer procedures. It supports your caregivers by helping them to understand your care needs, connects them to community resources for support, and assists in supporting you in your treatment choice. And finally, some symptoms such as shortness of breath and low energy can still be hard to control despite treatment and medication. Dialysis, on the other hand, can extend your life, giving you extra months or years. It can improve certain symptoms like poor appetite and leg swelling. Dialysis also takes time and energy to keep up a 3-day-a-week dialysis schedule. And lastly, many people may experience symptoms with dialysis such as pain and feeling wiped out. As I touched on earlier, there are other services your doctor may suggest when you choose conservative management as you move along in your care. They are palliative care or hospice. Palliative care is specialized medical care for people living with a serious illness. This type of care is focused on providing relief from the symptoms and stress of the illness. The goal is to improve quality of life for both the patient and the family. This option is available to you early on in conservative management. Hospice is a program of care and support for people at the end of their lives. A trained team of health professionals and caregivers provide symptom management and pain relief, as well as emotional and spiritual support. The hospice team also provides support to your family and caregivers. It's important to remember that you always have a choice and can change your mind at any time. Some people choose conservative management and never start on dialysis. Others start with conservative management, change their minds, and switch to dialysis treatment. And finally, there are also those who return to conservative management after they've decided dialysis wasn't right for them. None of these options is a wrong choice. We know that deciding on treatment for kidney failure is not an easy choice to make. Today, we hope that you've learned a little bit more about your option for conservative management. Congratulations! You've completed the module on conservative management. Please check out our website for additional educational modules in this series on kidney failure and treatment options for failing kidneys.